Hello everybody, Dr. Mike Schultz here. Today I'm going to briefly talk on the topic neurodevelopmental disorders in children, which includes spectrum disorders. As a child's nervous system begins to grow and develop, think of it as expanding in layers. As one layer grows and then completes its development, the next layer starts to get laid down. Now, one of the main features of the initial stage of development is the presence of primitive reflexes. These include the latch reflex, rooting reflex, plantar reflex, and the moral or startle reflex, to name just a few. Primitive reflexes are automatic and are essential for the survival of an infant. For example, the latch reflex occurs when mom's nipple touches the cheek of her newborn baby and the child automatically reaches out, latches, and starts to breastfeed. It's incredible. Now, as this initial stage of neurological development comes to a completion, roughly around that 3 to 6 month mark, primitive reflexes are supposed to begin to disappear or become extinguished. The completion of this stage of development is important because it makes way for higher, more advanced cortical brain connections, which are laid down and involved in such things as language, learning, and emotions. Unfortunately, not all children develop through these initial stages successfully, and one possible reason for this is trauma sustained during the early growth and development process. In any case, what we see linked to children with neurodevelopmental disorders such as those found on the spectrum is that their primitive reflexes have been retained. They are not disappearing as they should. When a parent brings in their child to see me and who has been suspected of being on the spectrum, the examination becomes highly focused on determining whether or not their child's primitive reflexes have been retained, and there is a specific neurological test for every reflex. If a child's primitive reflexes are found to be retained, then the care going forward focuses strongly on specific strategies known to be effective at helping children overcome these milestone hang-ups. In other words, care focuses on improving the health and function of the child's central nervous system. This approach encompasses a combination of both active care here in the office and specific exercises given to the child to be done at home. This is our approach, and we've had incredible success with it. I hope you enjoyed this video, and if you have any questions about the material discussed, please reach out to us. We'd be happy to assist. Have a great day.